Hey Patriots, welcome back to the Progressive Playbook. I'm your humble dealer, and today we'll start with this chart that sums up a study by the Commonwealth Fund showing how 11 countries compare in healthcare. And what you'll notice very quickly is the US spends nearly double on healthcare, yet has the worst performance by far. Performance is so low, they had to exclude it in the average of all countries to not throw off the average. Okay, let's get this out of the way. Some people might look at this and say, dealer, 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 these are cherry-picked countries. Why compare against just these 10? To that I say the US has been the world's largest economy for the last 130 years. You want to pat yourself on the back because our healthcare outcomes are better than Botswana's? There is no excuse as to why we shouldn't be at the top in healthcare. If anything, this particular study doesn't show other great countries like, here, I'll list off 10 more countries that routinely perform better than the US in healthcare. Finland, Denmark, Japan, Belgium, Austria, Korea, Israel, Ireland, Spain, Singapore, which is where I currently live. But for now, let's just focus on these 10. What's so special about these countries? What are they doing so differently? In this video, we'll explore 5 flavors of healthcare around the world, and I'll rate them based on how well I think they could work in the US. The first one is the Wild West.
Where did you get this guy?
Texas.
Texas? Are you insane?
Yeah.
As the name suggests, there are no rules, and this is the closest to what US healthcare is right now. The government doesn't do anything, and you as the individual have the option to choose from a bunch of different private insurance companies, each with their own different plans, whether it's HMO, PPO, EPO, gold, silver, bronze, all with their different monthly premiums, co-pays, deductibles. So if I'm a callous private insurance company in this sort of landscape, I want to make the most money, so I'll find every way to keep my prices high to match the demand of health insurance, but also I'll find every way to not pay you when you need me. If I make the coverage details confusing, I get to keep more of the money. I mentioned before that there are people who start with this premise that all government is inefficient, but here's a case where eliminating government creates a very inefficient system. Because there's a high demand for health insurance, you end up granting a lot of power to health insurance companies that aren't innovating anything. Usually other companies are paying the hefty monthly fees for their employers, which hurts their employment and their bottom line. Especially small startups that are trying to do the innovation, something that actually makes America great. My first job after graduating was in a biotech startup for cancer and infectious diseases, and one of our restrictions was in how many people we could hire because the company had to pay for everybody's health insurance. They just hired a bunch of people overseas, otherwise the company might not have survived. But then there are companies like McDonald's, which back in 2010 threatened to cut its healthcare plans, which were about the same quality as their cheeseburgers anyway. But what this tells me is that people who are the most screwed are the people who are working minimum wage, or getting laid off, or they're trying to start their own business venture. Again, something that makes America great. But speaking of fast food, check this out. Did you know that in the same year, there was a report that health insurance companies were investing nearly $2 billion in fast food chains? What? So health insurance companies are investing in the stuff that makes you sick and die early. They don't care about your health or well-being. They just want to make more money. That's why there was a huge fuss over health insurance companies denying patients because of pre-existing conditions. There was a 4-month-old baby who was denied health insurance because he was too fat. The insurance company was like, oh, technically his height and weight ratio fall under the obese category of the pediatric guidelines, and obesity is a pre-existing condition. That means it's not our responsibility. He's a baby. You want to tell a 4-month-old to get on Atkins? Wild West, 0 stars. We have to do better than this. And in 2009, a fellow by the name of Barack Obama stepped into the White House and tepidly tried to make things better. See, there was this idea that came out of a right-leaning think tank called the Heritage Foundation. This idea was supported by a bunch of Republicans in the 90s. It was called individual mandate. And as the name sounds, individuals are mandated to buy private health insurance. Obama, with the power of 70% approval rating, Democratic control over both houses, supermajority in the Senate, ready to overcome any filibuster, decided, oh, I'm going to compromise with my Republican friends. Here, let's do your healthcare plan. And every Republican was like, not if you're proposing it. Okay, so the good and the bad. The good is that it was moving towards covering more Americans, and it prevented insurance companies from discriminating against people based on pre-existing conditions. But just going back to this triangle, I feel like this is bringing the government into the problem in the worst way. I don't want my government telling me, hey, you have to buy an expensive monthly subscription. It's bringing the government in to create more demand for the insurance companies, which makes them even more powerful. Quick note on this, the reason this is not a great system for the US is the health insurance companies are already so powerful, as I've mentioned. It is possible to design a good universal private insurance system like they've done in the Netherlands or Switzerland. There's a lot of government regulation to keep the insurance companies in check. For example, in the Netherlands, 70% of private funding comes from taxes and employer contributions. There are only 4 major insurers, maybe 10 overall, as opposed to over 900 companies like in the US. It's an odd system, but it essentially works like universal healthcare because everybody has affordable health insurance. You do pay monthly premiums and you have out-of-pocket expenses, but that's capped at around 400 euros per year. You can go to any doctor you want, prescription drugs, hospital treatments, maternity care, all covered. So again, it is possible to make this a workable system, but in the current US insurance landscape, this is going to be very hard. So in terms of adopting it for the US, I'll give it 1 star. Then the 2020 Democratic primary, a bunch of people ran on pushing for a different system called the public option. This is a system that is finally starting to challenge the health insurance companies. In the spirit of competition, the public option says, okay, you guys run your private insurance the way you want, and we're going to use taxpayer money to set up a government-funded option that is designed to keep costs low. Ideally, this keeps the private insurance prices in check, but it really depends on how it's designed. So I like the German system. I think it's a great model. The way this works is everybody is automatically enrolled in a statutory health insurance. And this covers most things. It doesn't cover things like acupuncture, homeopathy, or Chinese medicine, but 90% of the population are on this public health insurance because you have to meet certain criteria to switch out of the system and into the private health insurance. People may do this if they want access to those special treatments or shorter wait times. If the US wants to do something like this, I'd be happy that it's in the right direction, but there are some big risks associated with trying to do this in the US. Again, the health insurance companies have some strong lobbying power. This is the first idea on our list that threatens their power and profit, and you better believe they will do what they can to first make sure that public option is weak, enticing most people to go private, and then they'll keep as many young and healthy people as they can while dumping sick and old people onto the public option. So if it winds up being the exact reverse numbers of Germany, where 90% of us are on the private system and 10% are on public, then we're basically back to individual mandate, except now we're adding an additional layer of bureaucracy, paying additional taxes to support the public option, and this could cost us up to $175 billion more per year. I'll give public option for the US 2 stars. When we allow for privatization, the benefit is usually competition drives innovation to make a good or service cheaper, faster, or more efficient. But it's a double-edged sword where you have to put in the right safeguards to prevent companies from taking advantage of us because they want to increase their profit. So I bring it back to this. What is the innovation for private health insurance? Less wait times perhaps, but how much can you really innovate on covering people's healthcare? The answer should be easy, right? If they're sick, they get help. It's not brain surgery. Well, actually, it could be brain surgery. So why are we privatizing this process? This is the question that has led most countries on our list to go with number 4, single-payer healthcare. So that's Australia, New Zealand, France, Canada, Norway, and Sweden. While the public option gives you the option of public versus private, the difference here is 100% of the population is immediately covered by the government for the vast majority of treatments. So when you walk into the doctor's office, you get seen or treated, and usually it's free for you at the point of service. Very clean and efficient for you. You don't have to worry about networks or plans or PPO, HMO, you're just covered. For doctors' offices, they still have to show that they aren't overcharging or purposely proposing a bunch of random scans and treatments, but they answer to a single payer, the government. They also don't have to worry about networks and plans, so their jobs become that much more efficient as well. What's great about the system, among many things, is that for the first time, we're greatly limiting the power of private insurance companies, only to the portion where they can provide an additional service on top of what a single payer already gives you. So if there's a demand for chiropractors, if there's a demand for cosmetic surgery, if there's a demand for shorter wait times, a supplemental insurance company could come in and say, we can get you that. Meanwhile, it gives the most freedom to see any doctor you want. This is a bit different from the last flavor on our healthcare list, socialized medicine. This is most like what the UK does, where the whole system is public, including doctors. So in their NHS system, you're given a doctor that you go to for everything, including a specialist. The UK also has private insurance companies that give you more time with your doctor, faster treatment, and specialty services. So to recap, Of these 5 different flavors of healthcare, I clearly don't like the first 2 at all. They keep the for-profit health insurance companies in power. I'm okay with the public option if it gets us a really good public option, similar to the German system. However, I think it leaves too great of a window for insurance companies to push back, resulting in an even more inefficient system. I like the idea of socialized medicine, but it might swing too much in the other direction for me, and I prefer people to have their freedom to choose which doctor they go to. So I'm going to give socialized medicine 4 stars. It's pretty good. I think I'm more in favor of keeping doctors private to allow them more flexibility to come up with innovative treatments that could potentially cost less money. And I like the idea of us being able to go to any doctor we want, wherever we are in the country. So my choice is single-payer healthcare with public coverage of private doctors. 5 stars. And the thing is, most people agree, whether you call yourself a Democrat or a Republican. But what's wild is the conversation in Washington, if there is one at all, is between the first 2 options. The 2020 presidential election was between a guy who supported option 1 versus a guy who supported option 2. And it's looking like it's going to repeat in 2024. This is what's called the Overton window, the range of acceptable discourse on a given topic. But in 2020, we also had this option to go with a different candidate who was fighting for single-payer healthcare, the independent Vermont Senator Bernard Sanders.
I believe that healthcare is a right of all people. I believe that there is something wrong when we are spending...
Where did that right come from in your mind?
Being a human being. Being a human being.
And because he was so popular, everyone else in the primary race had to at least pretend to be for a public option just to compete with the guy. And for a short while, he shifted the Overton window by running under the banner of Medicare for All, a clever way to expand on the extremely popular and already established Medicare program until everyone is covered. It's so important that we pick this banner up, reignite the spark behind Medicare for All. So in the next video, we're going to dive deeper into this program. I'm going to give you my 10-point bulletproof case for Medicare for All. If you enjoyed this video, be sure to check out that one. And if you're trusting my voice on this platform, be sure to hit me with that sweet LSB, like, subscribe, and bell, and I'll deal ya the next one.